Mark's just going to do a couple of minutes summarising some of the main themes and messages that he's heard so far this morning, then we'll move into coffee. Thank you, Mark.
So I've been given the pleasure of trying to synthesise the films and what came out of those, the conversation in the room and the word clouds in a kind of live sort of situation here. So I'll do my best. So what we heard this morning, why we love care, generally this is a massive potential opportunity to build upon, and it's not widely recognised, and it matters. It matters both economically, and it matters from a human point of view. There are three main areas that conversation was focusing on. One was relationship, one was pride, it's fabulous, and one it's crucial. I just want to look at those three things. Talked about relationship. None of the care workers talked about tasks. They talked about relationships. They talked about family. They talked about love, the humanity connection. And caring gives them as much it gives the cared for. It has meaning to both. It is a relationship. And there's some profound experiences. And it is a privilege in terms of the small things that we take for granted as healthy individuals, but also the large, most significant life events in our lives. And it's true family, it's a calling. You prioritise others over yourselves. And we need to recognise and reward that selflessness. Crucial. We heard words of backbone of the system about prevention. We'll probably come on to that more. They're often the only people that the people cared for will ever see. It provides independence and it's pivotal. We heard words about the glue, the underground heart of the nation. It is more than just care, it does life. And then we had the pride, how fabulous, working with complexity, the skills that you use and the judgment you use, not only for physical but social complexity out there. You are the eyes and ears of the system, and what you do makes a tangible difference. It's one of the few jobs you can actually see the difference that you make, and you are an inspiration. So, looking at the barriers, it came across that social care is not widely recognised. It's not recognised maybe by the system, but certainly by the general public. And how can we then, with great things, talk through the white paper about training coming on board, about looking for innovation at a local level, because the solutions will come, innovation will come at a local level. How are we going to get people to engage in this if they're not aware of it? And we talked about how it might be a societal issue. We talked about head-based care, skills and knowledge, hand-based care, the physical aspect of care, but how do we value heart-based care? How do we as commissioners, how do we recognise that as a society where we pay dog walkers more than care workers? And how, society, do we need to look at some of the most important, biggest differences in our lives we can make to people through love and through the heart-based approach? And finally, we can all operate in our bits, but actually operating as a whole, together. And, recruiting, and we're not paying enough attention as a system to retention, it's just a hole in that bucket. So that's what I'm going to conclude as far as what I heard this morning from all those sources. So we heard the films, we heard your comments, and it really focused around 6 areas. Recognition, talked about recognition. Recognition is not just pay, it is pay. Pay is very important, but it's recognition. It's a demanding job. It's a complex job. We need to recognise the greatness of social care in the system. We need to have parity, equality, respect. We understand that pay is not going to be just a national solution, but it's going to be a local solution as well. I'll come back to that in a minute. Talked about professionalisation. Now that's echoed in the white paper as well. Progression, pathways, changing the narrative, a maximally trained workforce, think of what that could do, the potential around it. Lots of conversation about prevention and about how this could protect individuals and our system and the NHS, and how we should be investing in prevention in our community and getting people to be independent there, stopping people going to hospital. Talked about integration and about local mutual collaboration. John talked about lower your gun to collaborate. shared systems. And what came across with all of this was this trust us. So once again, we all need to lower our guns. We need to look towards local and mutual solutions and trust us to work together to get on with the job. So overall, stepping aside from the zap food, no worries, we need to work through and look at systemic solutions and look at the source. Now, we can look at our current pressures and address it with paracetamol, but through collaboration, trust, and local leadership, we will achieve something. So it's about proactive. The white paper, which was explained, covers a number of things: pathways and training, recognition of value, innovation, personalisation, access and choice, and about leadership locally. And it's the leadership locally that what we can do is to look at the why and the what in the white paper and describe how we're going to do it locally. So it's a whole system approach. We need to be brave, creative, collective and flexible. And looking at the solutions, well, there's an invitation for all of us to go to London and visit and share our story, which actually talks more of a collaboration and a understanding of each other. We have something to offer, you a local view and an energy and a positivity to solve things, and we take up the invitation. The county deal, looking at things collectively, and Team Devon looking at things collectively as a unified voice that will also include understanding and recognising the economic value of it, and that extends to working beyond sectors and working with the training education sector and the health and social care sector, a better understanding about the NHS to describe what their issues are to the social care sector, so the social care sector can solve it. And it's about the wider sectors, what innovations and technologies and adaptations they can bring into the mix to solve that as a whole county. So I think that's probably my wrap up, my summary.